Good afternoon. Pat Zemer here with MagnaWave for the Tuesday edition of the MagnaWave Office Hours, coming to you today on Facebook, YouTube, Castbox for those who want to listen in a radio fashion. Hazel's with us on Castbox. We'll have some other folks joining us there as well. So I want to welcome you to this edition. Please share this broadcast with your friends. So if they'd like to come on board and ask some questions, they could certainly do that. And let's see, Katie's with us today from Texas. Thank you. And Northern Lights is with us. Carly's with us today. That's wonderful. Hazel's with us, as I said. So we're glad to be here. If you'd like to talk with me, send a text to 502-599-9722, and I will give you a call back, and then we can have a conversation about whatever it is that you would like to discuss. Also, remember, MagnaCon's coming up. You can have virtual tickets for MagnaCon. They're available on the website. It's coming up in June. The live event portion of MagnaCon is currently sold out, so we're excited about that. We have 200 folks who will be able to be with us in person, and then, of course, you can join us virtually. There'll be a lot of prizes, a lot of giveaways, a lot of great information, new speakers this year, so it's going to be a great event coming up in June. So we're very excited about that and looking forward to that as well. Okay, so if you have a question, simply put it in the box and I'll be happy to have a look at it. Let's see if there's anything in there at this point. Nope. Kim's with us, Emily's with us, Dion's with us, Heather Harris is with us. So we're glad to, from Arkansas, not Alaska, Arkansas. So been driving a lot, just drove home. We're back in Kentucky and we're glad to be here. And so getting ready for springtime and the flowers are blooming and everything's beautiful here in Kentucky. Derby coming up this week. We're excited about that. We also participated in the Rolex it's not Rolex anymore. It's the, what is it? The car. Volvo, which car? I forget what it is. But at any rate, the 3-day event in Lexington, and that was exciting to be there and help the horses and the riders at the 3-day event this past year. The Land Rover, that's what it was. Thanks, Chris. It was the Land Rover 3-day event in Lexington for the eventing riders. So we're happy to be here. I want to go on, and I had a question that was sent to me that I kind of want to address. The practitioner was talking about treating her dog, treating the head of the dog, if that's okay. And certainly in areas of depression and for PTSD and all those types of situations, we quite often treat around the head of the body. We treat the pole of the horses. And so it's certainly okay to treat the head of a dog or a cat as well. We don't run a lot of intensity, but just for comfort purposes, we want it to be comfortable when it's on the head and when you're doing the area of the brain. But typically there is no danger or fear to that. If it was too much intensity, the animal would walk away, would not want you to do it. If it's okay and there is some movement in the jowl or the face of the animal, that's all right as well, but you just want to make sure that they're comfortable, and it's not unusual to do that. And as a matter of fact, in the study that we're doing at the University of Colorado for concussions, we're treating the head area of people for who have suffered concussions types of injuries, and so we are putting these machines right on the head or right in the area of the head for those. For that study that Dr. Larry Lyons is doing for us at the University of Colorado. More information will be coming on that. Sean keeps us up to speed with regard to what they're doing and what's going on in that particular study at this time. Let's see. Since MagnaWave increases the uptake of medication and supplements, is it best to wait a day to treat a dog who receives a sub-Q Adequan, or treat the same day to enhance the results? In that type situation, you're wanting the absorption to be as good as possible. And so certainly you would discuss that with your veterinarian, but to treat in the same time that you're doing that, we used to do that all the time. They would give Adequan injections or Legend injections, and we would treat at the same time. Now, some people, and it's a personal preference, wait 24 hours or so, 24 to 36 hours, to make sure that it is in the system and it is doing its job, and then come back and treat as an enhancement to the medication that they're supplying. But it is not unusual. If they're injecting, or if it's going into the bursa or into the sac, if you will, that it can encases the joint, it's not gonna be dispersed. It's not going to leave the area. Now, if someone is putting something into the tissue where they used to block hoof, where they block a hoof, or they do something like that, if it's a muscular injection, but you want to get it through the system of the body, then you can certainly aid the distribution of the medication to the body by treating either before or right after the injection or the supplement is taken, to help it best be absorbed into the body and do its job. So great question, and it's something that people have talked about, and we've done a lot of talking with it. Is there an ETA for the revised MagEnergy Mat Guard? I loved that attachment. That's a good question, Kim. I will reach out and see where we are on that. I know that Sean has been working on that as well with the rubber company to make sure that that's all taken care of, the issues that we were having. So I would think it's imminent that it will be back available. And when Elaine might be joining us here in a little bit, she can certainly bring us up to speed on that question as well. Angela's here with us from Michigan. Lindsay from Ledbetter, Kentucky. Lindsay, thank you for joining us. Let's see, since MagnaWave, okay. No, is there another question here? I have my first gruesome open wound to work on, and a client has agreed to 3 times a week. So excited. Can you tell me if the healing works different on open wounds if you treat low and long, or moderate and shorter? Thanks. Well, Kim, that's a good question. And typically you would probably want to be moderate, working over an open wound, as you're working to get good blood flow to the wound, get a good situation so it can begin the healing process. And so moderate, perhaps for a little longer, would be something that would certainly be available and not wrong to do. You can, of course, we've also done it to where you treat them just for a short period of time, and perhaps they're bandaged and you want to treat for 6 to 8 minutes on a moderate setting when there's no bleeding or anything like that going on, and you maybe run a little higher, as long as the comfort is there. You want to make sure that the animal is comfortable and it's with the treatment, and the intensity is not so much that they want to move away from the intensity or from the treatment. So that's the important thing to always keep in mind and keep in place. But if you were putting a little lower intensity and running for a longer period of time, you're just going to continue to nourish the area with good blood flow and good oxygenation for the entire treatment scope. And that, again, that could certainly be of benefit to the process that you're dealing with. Okay, let's see. Does the Kentucky have the quarantine period for travelers from Canada? Rob's asking, wondering for MagnaCon. I don't think so. I think if you're, if you're practicing good social distancing and good protocols for being in a public spot. We just came back to Kentucky. There's no mention of quarantining. We were in Florida. No mention of that being required in the state. I know when we came back last year and we put our RV at a park here in Kentucky, of course, we were right at the height, just, in April and so forth of last year, everybody was quarantining all the time. And that's not necessarily the case that we're experiencing now. And I do understand that people going to Canada, I have some friends that went back home this week to Canada, and that they have to quarantine once they get back. That has not been the case on what we experienced in Florida and what is currently happening here in Kentucky. Now, coming from Canada, I think, I don't know why that would change anything, but that's a good question to ask if your authorities would like you to quarantine before going back to Canada or when you get back after MagnaCon. Good question. We'll try to do a little more research on that one as well. Great question, Rob. Thank you so much. Let's see. for those who buy online tickets, should we have gotten anything in our email or mail? Well, I'm sure you will get some information via email. You should have, I would assume that you would have received an acknowledgement. Chris, is that the case when they sign up? Do they get an acknowledgement from us as to their sign up for? Yes, they do. So you should have received that. If you don't have that, you might send an email at support@MagnaWave PEMF and ask the question. Perhaps it went to your junk file. You want to check that and make sure that everything is okay there. And if you don't see it, just send an email to support@MagnaWave PEMF. They'll pull up your information and make sure that you get the information and the acknowledgments that you need. That'll give you the times and how to get in and so on and so forth. So yes, great question. And Chris does say that there is an acknowledgement that goes out if you register for the virtual MagnaCon. Let's see here. I just received my Julian Duo last week. I've MW myself and family members who have gotten the flu. Lots of back pain hours after. Have you heard of that before and possible reasons why? Lots of back pain for hours after. You want to make sure that you're comfortable in your settings, Lori. If someone is having a flu and it's in their body and it can settle in their joints or in their back, it's not uncommon when you have flu-like symptoms or when you're suffering from the flu to have aches and pains in your body. Now, and if you're going to have them and you're MagnaWaving, can it make that appear maybe a little quicker? That could be the case. Would it make it last longer? Not necessarily. That would not be the case when you're dealing with the flu-like types of situations. But if people are going to have that as part of their flu process, what I've noticed in the past when I've used the device when I wasn't feeling well, and it's a virus that you're dealing with like the flu, it's not going to necessarily relieve it. What it typically does is pushes you through it a little more rapidly than if you just suffered through it on a normal basis. So that could be something that's going on there. It's not going to necessarily eliminate what's going to happen, but it can potentially push them through it a little more rapidly. So that's a good question, Lori, and we will take a look at that as well. Terry asked the question, dog just attacked by a raccoon, now in quarantine, to watch for behavior changes that has puncture wounds, not bleeding now, on face and inside the cheeks. Would like to know if okay to PMF or LZR, or could that make the diseases it might have gotten worse? Again, I would talk to the veterinarian that you're dealing with there. If you're watching for changes in behavior and you want to make sure that the animal is okay from the attack, so they're in a quarantine period, I would let that expire. I don't know how long the period is that you're dealing with, but just so they can keep an eye on what's going on. You don't want to, if it's going to happen, you don't want to maybe push it any quicker than maybe the medication's going to deal with. So again, I think that's a very enlightening question that we need to have a look at, but it really shouldn't do anything to make anything worse. Good oxygenation and good blood flow is beneficial to those types of situations in order to help the process along and help the healing process and the medication that they're providing for the animal. So that it's certainly something to discuss with the veterinarian. I would suspect that they may want you to wait through the quarantine period and then go. We used to get that sometimes with infections. There'd be an infection and there'd be a temperature, and the veterinarian would recommend, let's wait till we do the antibiotics. Let them do their job, let the temperature subside a little bit, and then begin the treatments to help relieve the pain and get things back to normal. So that's quite often the way that people take that approach. Hope that helps. Okay, let's see if we can PM me. I'm also, oh, okay, someone's just talking about, can the LZR be used on a person with nerve pain in the leg? He's in a wheelchair. He also has an implanted, where'd it go? Implanted battery device. Well, the LZR is not going to interfere with the battery device at all. And if he's having pain in the leg, certainly it could be beneficial to that and to help the blood circulation and to help relieve the inflammation in that particular area. So I would think that that would certainly be something that you could do in that case. Homeopathic lydium is great for puncture wounds and preventing infection in them. Oh, Leslie is writing. I use 30 C's strength when my dog got a puncture wounds from a dog fight. Okay, thank you, Leslie, for sharing that. So, Wendy, I hope that helps with your question on the LZR and the nerve pain in the legs. Would certainly be beneficial. I use my LZR. I've been having a spot in my mid back that my massage person works on regularly. It's stress related. I get to thinking about things, and you know how you tighten up, and all of a sudden you have some pain, and it radiates up my back into my shoulder, and I'll treat the area with my MagnaWave, and then I'll come treat the little area that I'm having a problem with here with the LZR afterwards, and I get a lot of additional relief utilizing the LZR on those areas. So hope that helps. Aaron's with us this morning. How long, Leslie Shermoy asks, how long the Pulse Probe will be on sale? That's a great question. Perhaps Elaine will be joining us, and she handles that information and be able to tell us what the situation is on the sale and how long it will be, how long it will last on the Pulse Probe. Any recommendations on thinking outside the box with a client who's having headaches every single day? They recommended Botox, but she's trying PEMF first. I've been doing some reading and see where they have used a Botox type of treatment for folks with headaches and those types of situations. And the PEMF can certainly be beneficial to help relieving stress and help relieve the situation that they're having with headaches. We always recommend that you treat the head, the back of the head, the shoulder area coming up and down this way with the coils, and then treat the feet. Kind of a reflexology type of situation to treat the feet at the same time to get that stimulation. If she's trying to avoid injections and doesn't want to have that type of fear in her mind or doing something like that, the PEMF would be certainly a way to approach it to see if we can get the relief that they might be looking for. And again, each situation is different. Each person is different when they have situations that in what is anatomically controlling it, how much of it could be a chemical imbalance, what could it be that's causing various situations, and so every person's different, so you get different results. But as a rule, we have seen very good results treating headaches, whether they're migraines or just standard or just regular type of headaches that people may have, and looking for a way to relieve the situation with good blood flow and good oxygenation to the brain. If you'd like to talk to me, 502-599-9722. I'll give you a call back and we can discuss the situation. Let's see if we've had any, nope, no one has sent a text at this point. But again, we're here for you if you'd like to have a conversation. How long would you wait to MagnaWave after a Botox injection? That's a good question. I would say you might want to let it get absorbed into the tissue, 24 hours or so, let it be in there and do what it's doing. And maybe 24 to 48 hours and then begin MagnaWaving. Are you looking, I'd be interested to know if you could put it in what you're using the MagnaWave for after the injection. Pain, bruising. I know that there is some bruising that can occur if it's being used cosmetically. There can be some bruising, and what people do after that is they wait 24, 48 hours, let it get in place, and then do a light MagnaWave over the area to again help eliminate or relieve the bruising that sometimes occurs from those types of injections. Let's see. Hello, everyone from Northern Illinois. Cam's with us from Northern Illinois. Let's see. Janet is with us from the UK. Can MagnaWave help heal a bone cyst on a horse's hock? How long roughly? If so, please. Well, again, each animal is different. Don't know how long the cyst has been there, but can the pulsing and the oxygenation and the blood flow to the area help relieve the cyst situation? Potentially that would be a result that you'd be looking for and could occur in those types of situations. How long? I would treat 5 or 10 minutes on the area at a very moderate setting, and let the animal tell you how it feels and with the way it reacts. And I would do it as often as possible to help relieve that situation. I would say quite often what works very well is to treat 4 or 5 times in a row, or once or twice a day for 4 or 5 days, and then begin treating every other day or every third day or once a week, whatever is appropriate for the client and that they're comfortable with, and they can have that happen. But to go approach something like that regularly, I mean, we do that a lot in sports injuries. You'll treat several days in a row immediately. Quite often, the more quickly you get at a problem, the more quickly you achieve the results that you're looking for, or you have the results that you're looking for. If you wait, and if it's been prolonged and it's been there, sometimes it's harder to get at it, to get ahead of it. So that's one of the keys, is treat as soon as you have an issue to keep it from getting worse, and to try to keep it in check. So, but I would think also that it could be beneficial in those types of situations. Okay, let's see. I have what's the protocol for a horse after a kissing spine surgery? Okay, well, they're wanting that to heal. They don't want any buildup of scar tissue. So the protocol, again, once the bleeding has been is controlled and everything is in good shape there, you can begin to treat again at a setting that is comfortable for the animal. I would treat as often as possible to, again, keep the inflammation in check so it doesn't begin to cause problems in the healing process, and to potentially help speed the healing process along. I would say, it depending on if it's a client that you're dealing with, 2 or 3 times a week for the first 2 or 3 weeks, and then as needed as you see the recovery process going on. Let's see. What's the protocol of kissing spine? Okay, I have a client who use it cosmetically on their face, and also for migraines. Thank you, Sophia, for sharing that. Yes, a lot of people do that, and I know that we're doing work with some cosmetic surgeons to help reduce the amount of scarring that someone has from that type of cosmetic surgery, and to help the bruising situation, and to help the healing process move along perhaps a little quicker than normal in those types of situations. So it's used more, and we are working to find some docs that will work with us, that we can put together, I don't want to say a study, but some anecdotal types of situations, or from some question and answer surveys, to be able to see how it's worked with people and what the process was and how many treatments they had, so we can keep a record on it. So at some point in time, we may be able to, in fact, have a study dealing those types of situations, dealing with those situations. Can MagnaWave help with anxiety issues? From Oxford, Michigan. There have been a lot of cases to where people have used PEMF as a relaxing mode. We get that when you treat someone, they quite often become very relaxed. It gives them a sense of well-being. You don't necessarily have to treat the head area, although some people do. They will put the coils on the shoulders and treat this way, coming up and down through the coil. And for anxiety, PTSD, depression, there are some PEMF devices that are approved for depression states, and they are using PEMF to combat that and deal with it. So any of those situations in a chair where you're doing a full body can be very relaxing to the body. Good oxygenated blood that goes to the brain, the lungs, and everything, and it's just very relieving. Quite often people who have PEMF treatments or MagnaWave treatments sleep better the following night or the night after treatment, and it aids in sleep. So, which certainly is good for anxiety, get good rest and to sleep well. So that's always something to think about and use as best you can for those types of anxiety, depression, PTSD, those types of indications that people deal with. Certainly always you're talking with a doctor and you're not trying to heal anything. We don't do that. You're just providing a sense of well-being and comfort to some people, which can be very beneficial for the situations that they have in their life. Let's see, new comments here. Let's see. I'm also curious to hear a response to this. However, let's see, what is it? Okay, look, let me come back. I'm sorry. I'm trying to follow the notes here. Let's see. Is it okay to use HydroWave in conjunction with essential oils? Would HydroWave interact with essential oils such as frankincense or lemongrass when it is used on a wound? The HydroWave is oxygenated water with the microclusters of silver, nano-sized clusters of silver to get into the bloodstream and help fight any infection or things that's going on. I don't think that it would have any cancelization, if you will, on essential oils. You might do it before you do the oils, let it get into the body, let it be into the wound or what you're doing, and then apply your oils, however you're doing that, to help that situation. Again, you always want to verify with your veterinarian. There are a lot of veterinarians that are using oils in their practices, and they understand how people may use them and recommend to how they can use the oil, whether it's the dropping or the spray or the how they're doing the application to the areas to get a sense of well-being and to help the enhance what's going on. So, but I don't see any reason why the HydroWave would do anything to dissipate the effect of the oils. I would recommend, though, that you do them, let them each do their job separately and beneficially for what you're looking to achieve. Okay. Does the LZR help reduce the chance of scars on an injury? And lasers and light therapy have been used for a long time to help keep scarring at bay, to help the healing process proceed as expected. And so I would have to say that the LZR would be very beneficial. Dr. Turchin covers a lot of that in his book that comes with each device as to how it is used and how he has used it on various wounds to enhance the healing situation that you're looking for with those types of wounds. And so I would think the LZR would be very beneficial to that. Let's see, C60 for dogs and horses. Is this coming soon? Actually, there are people that use C60 in their foods, in their animals, and we are working. Max is working on a various way to administer. You could use the gel caps to get the C60 into the digestive system of the animals or the dogs, or you could put it on their food and let them ingest it in that fashion, and it would be very beneficial for the telomeres and the work that the C60 does as a supplement for health and wellness in the body. And so most certainly would be something to look at. Also done an hour after a run. I guess they're talking about how they use the C60. Is the MW app still down? What's the case there, Chris? Is the app, it's still down? Yeah, they're working on the servers. So I wanted to, you can check on that. I'd call support if you'd like, and they'll give you an idea of where it's at in the process of coming back up. What is the estimated time, Chris? Do we know when it should be back up? It's up and down right now? Working on it. Okay. He's talking to me in sign language. Okay. Will Dr. Turchin be attending MagnaCon? You know, that's been discussed, and I'm, again, 24 hours moving to new servers. So the app should be up, Chris tells me, within 24 hours. I know that Dr. Turchin may be at MagnaCon. I haven't seen the list of the exactly what's going on there for the speakers that are coming. And is he on the list there, Chris? Dr. Turchin? He's not. I don't know. We'll find out. We'll find out and get back to you. Perhaps if Aaron's with us or someone who's helped work on that scheduling can bring us up to speed. I know we talked about it, and that was in the plans to have Dr. Turchin be there and to discuss the LZR and the uses and teach a class or have a speaking engagement on that. So again, I'll find out. We'll bring that up to speed for you. Let's see. We are still making some updates. We will make the announcement when it's back up. Yes. All right. That's with regard to the app. Let's see. Reposting Lindsay's question on performance horses, barrel horses. How long before and after a run do you prefer to MagnaWave them for maintenance, no injury? On before you do, like the evening before or hours before a run. Thank you. Okay. When's the best time to treat a performance horses? Well, it really, every horse is different. What you want to make sure is that you test. And the story is, I've had a couple of situations where one of my very first practitioners was a jumper, and the horse was having some issues. It was having some pain. And so this wasn't just to keep them feel good type of thing. Wanted to just kind of approach the pain situation in the back of the horse. And we did it just before the horse went to the ring, and the horse didn't really care what it did in the ring. It was so relaxed after the treatment. So we learned on that animal, if you would treat the day before the event, and then let them go to the event, or the evening before. And that's where it varies from animal to animal. I did the same thing at the racetrack. I went to the racetrack. The guy says, here, my horse is running tonight at 6 o'clock, treating this afternoon at 2 o'clock. And did that. And the horse was kind of thinking, I'm relaxed. I've taken the edge off. I really don't care to run in this race. So in that particular horse, we learned, again, the night before, day before, and then how it would perform best. It's very difficult to go wrong treating a performance animal the night before or the morning of, 6 to 8 hours out ahead of an event before the event. Once the event is over and you want to help recovery and you want to keep the horse comfortable, you can do it immediately. Again, if there's something going on that's there, you know how horses are, they may be having something happening and you don't know it until it all of a sudden puts them down. And all of a sudden they become lame. You rode them yesterday and they were great. Tomorrow you get on and they're, what went on. So from the recovery standpoint, if they perform today or they work today and you want to treat them tonight or after the event, the sooner the better, and to keep them in good shape. And then maybe once a week or twice a week, the animal will tell you where it's comfortable and where it maintains its optimum performance levels. And so always test that. What we do now with racehorses, what I began to do years ago, is they would breeze the horse. In other words, they'd take it out in race conditions and work it a little bit at racing speed with another horse and that type of thing. Well, we would often treat them before they went to breeze or before they go breeze and see how they perform. If they perform well and they ran better, then that's we would learn to do that. If on a particular breeze, they just kind of took their edge off and they were unhappy with that, then we would take the same horse before the next breeze and treat it the night before the breeze and see how they would do. And we would learn this horse needs to be night before, this horse needs to be 6-8 hours, this horse needs to be immediately. I've had horses in the jumping ring that they're under saddle and they're getting ready to go and we're treating the feet. Or we're treating the shoulders or the hips, and they're ready to go to the ring, and they're at the ring in an hour, and that horse just responds in that fashion and in those types of situations. Once had a Grand Prix horse that just was $1 million horse, and he just was not performing when he went into the ring. It just like he was great before he got to, it was an anxiety type of situation. So we treated the pole. And we treated the pole the afternoon or the morning before the event in the afternoon, and the horse went out and did wonderful because it just was more relaxed and paid better attention to what was happening with the rider. Again, varies from animal to animal how and when you do that. So that's the trick that you have to work on and just learn your animals or your clients' animals. So that's what's the best time to treat them to get the optimal results that you're looking for. Had some people come over from Dubai and they wanted to know what we could do to make their camels run faster. And I said, well, you can improve range of motion to get better strides in the camel races, or you can treat their lungs so they can breathe a little easier. But a lot of times you're not going to necessarily make them run any faster, but you can make them run fast longer. They can have better stamina. They can have better blood oxygen flow through their lungs. Their joints are more fluid, and so they just perform in a manner that they can do it a little longer. And when I used to coach soccer, that was always my kids in soccer. It was always my old thing was the team that could run the fastest, the longest is the team that's going to win, because you want to wear the other guys down or the other team down, and by keeping up your stamina and running fast and hard. So we do our sprints and all that stuff, and to me that was just as important as the kicking and the catching and the whole thing that they're doing on the pitch. But to be able to play the game at your maximum ability for the longest period of time is quite often what makes the difference in who wins and who loses in those types of competition situations. And it's the same thing for animals as well. I told the guys from Dubai, I can make them run fast longer better than I can make them run faster by simply extending their range of motion or whatever. Great questions. Let's see. Sarah asked the question. Dr. Turchin will be at the MagnaCon and in the LZR booth. Okay, so Sarah's got a question. Can you please clarify that the appropriate dosage would be for HydroWave for an approximate 60-pound dog to drink with a benign tumor in his mouth along with his MagnaWave? I see dosage on the website, but was wondering if the amount would differ from humans to animals. Thank you. I wouldn't think the amount would need to be different between humans and animals. A lot of people do mix it down. They'll make it 50-50, or they'll put it in the drinking water. They'll put, depending how much they're doing, a couple of capfuls in the drinking water, or an ounce or so in the drinking water that they're going to drink pretty quickly. Quite often, some folks will take HydroWave and they'll put an ounce or so in a 16-ounce bottle of water and drink that water over the period of an hour or so to get it into the system. And so when you're talking about maintenance, where we mix, I believe it's 4 ounces to a gallon of water, and that'll give you, and you mix 8 ounces to a gallon of water and drink it in 4 to 5 ounce glasses morning and night, and that'll give you several days, 10 to 15 days worth of good water to do that. If you're doing that to your horse, I do know that products like Lubricin for joints, there is less Lubricin or less HA in the horse dosage than there is in the human product. So they want a little more in the human product to better deal with joint issues with the Lubricin type of product. HydroWave, which is a water-based oxygen type of content, if you want to boost it a little bit, you're not hurting anything. It's not, you're just going to use more of it. So you don't necessarily need to be in that type of situation. So I would do for small dogs, what we use for our little 4-pounder is we'll put a cap full of HydroWave into her drinking water a couple times a week, just to keep that going through her system so she stays healthy. And that's our whole goal there, to do that. We're not having a situation that we're dealing with in that case. With the tumor in the mouth, you could spray it. You could let them ingest it, let it get into the bloodstream and help those types of situations. But I would look at it from that perspective. Okay, great. Let's see. Hi, everyone. Are there any Derby or Kentucky Oaks trainers who are currently using MagnaWave on the horses to prepare to recover? Most certainly. Typically in the Derby, where there's 20 horses in the Derby, 10 to 12 of those horses will be owned by people who utilize MagnaWave in their barns and use it on their various horses, and quite often on their Derby running horses. I've been traveling here a little bit. I need to get back to the Derby here in the next day or so and take a look at the folks in the Derby, who they are they using MagnaWave? We've had very good success in the Derby over the years, and in the Oaks over the years with the various contenders. It's certainly, we have practitioners on the backside at Churchill Downs. There are veterinarians on the backside at Churchill Downs that use our equipment. There are trainers that own the equipment and use it. Many of the trainers utilize MagnaWave and PEMF in their barns exclusively. I could go down the list and I'll do that. But yes, there are several that utilize the MagnaWave devices and for their horses in and around the Derby. And certainly some, there's competitors. So some of them use other devices, other competitors' devices, but there's extensive use of PEMF in and around the racing industry today. Let's see. Okay, more comments. Let me make sure. Is there still a chance for more tickets will possibly become available for the in-person MagnaCon? Do you get discount for either if you've purchased MagnaWave? Thank you. Whereas pricing for MagnaCon, we give away a lot of gifts and a lot of prizes at MagnaCon. I don't know what the discount situation is at this point. I think we're limited on how many we can have based on what the hotel is set up for. Now they are talking about easing some restrictions in Kentucky as far as the mask mandate and how many people they're letting attend sporting events. And I know that they're working on various sporting. I mean, I read today where Roger Penske at the Indianapolis 500 wants 220,000 people to be there in a good social distancing type of situation. The Derby is trying to do the same thing. So, I don't want to say that, yes, if they relax the attendance figures that we're going to all of a sudden be able to open up more tickets. But if they tell us we can do that, and we would certainly do that. We'd want as many people to attend MagnaCon as possible. But right now, I don't have a firm answer on where we're going with the regulations or what they're requiring us to do in Kentucky. When we set it up, they told us that based on the venue and how we're going to set up the room, 200 spaces in the room would be max. And that's how we approached it. And we will certainly, now is the time, here it is, the 1st of May coming up this weekend and for Derby. And we'll be able to learn more about what they're going to do, and we will certainly follow suit to be able to benefit as many folks as we can. So look forward to potential announcements there. Let's see. Would be great to have a list of horses using MagnaWave in the Oaks and the Derby. Typically, we put something like that on Facebook as we get closer to who is using and what's going on. Some trainers are pretty close to the belt as to what they do with their animals, and so some will tell us, some won't tell us what they're doing for a particular animal because just how people are. People are funny when they do that kind of stuff. But we will. I'll have a look at it today, and again, I've been traveling for 3 days, so I haven't had a chance to take a look at it, but we will do that as we go along. Let's see. Can you talk more about detail about how Braintap works? Can it help reset the brain for people with anxiety, PTSD, sensory overload? What's its main purpose and how does it work? Okay. Braintap's an excellent piece of equipment. Dr. Patrick Porter is a developer of Braintap, and he has the devices. And basically, it does serve to reset the body. It does it with light in the ears. There are sensory in the ears, and so they'll have some light in the ears. They use music and sound to do the same thing, and the sound is produced in a certain fashion to provide relaxation for anxiety, for PTSD, and so forth. And then there's lights also in the headset that will blink and work on the eyes through the closed eye and approach it in that fashion. But that's basically what we're doing, is we're trying to take the sound, the light, and the music that's coming and the spoken word to help people ride better, to help people perform better in their particular sport of choice, whether it's tennis, golf, horse riding, whatever it may be, competition. So they take the spoken word with music and light and help enrich what's going on in the brain to help you have better focus with what you're doing, to help you learn better about what you're trying to accomplish. And so most certainly that's what the Braintap is designed to do. And it does that. It works very effectively, again, through the ears, through the light in the ears and the eye and the sound that occurs and the spoken word in the learning process utilized with Braintap. Braintap can be used without the headsets. If you want to listen to the music and listen to the auditory portion and get the message to relax or to learn or to change your mindset on how you want to approach the animal that you're riding or approach the sport that you're playing, you can do it either way. But the headset is just a tremendous bonus to utilizing the Braintap equipment. And again, if you'd like to know more about that, talk to your product specialist at MagnaWave, and they can get you some more information so you can better understand that type situation. Let's see. Maureen loves the Braintap. Becky loves the Braintap. And the other thing that's really cool about Braintap, if you're using PEMF or using MagnaWave, there is a program on Braintap that you can let maybe the owner of the animal that you're treating do the Braintap session so they can relax, which is a good thing for them to be relaxed. They can hear and understand what the PEMF is doing because the process explains the PEMF and the MagnaWave as they're potentially either getting a treatment or their horse is being treated and they just want to better understand and relax and learn about MagnaWave and PEMF. So all those things happen. There's a myriad of, weight loss, smoking cessation, all this type of stuff is available on the Braintap app, in addition to being very beneficial with the relaxation that so many people need and want to have. Okay. Thanks everyone. Okay, for the comments on the, yes, thanks for telling folks that you're liking your Braintap and how you're using it. What is the difference between the pet mat and the large mat? Well, the pet mat's made more like a bed. And it's more like a pet bed, and so a lot of folks would like to have that so it's more comfortable. It's durable. They're not going to chew it up and have it become a problem. So you don't want them chewing up your regular mat or anything like that. What's being applied is the same. It's not that we're changing the signals or changing anything because it's a pet mat. That's not what's going on. It's just more available for use with the animals if we do it in that fashion. And so it just is, again, some animals are more comfortable laying on a little bed-like type of cushion as opposed to just a leather covered or a vinyl covered mat. But you could put that mat underneath a dog bed or a dog cushion and treat right up through the cushion, and you're achieving very similar type of things. So it's just how you want to use it and where you want to use it, and that's what it's doing. If you've got a mat and you're happy, you don't have to have a dog mat. But if you want a mat for your dog, that way you could just leave the mat there. The dog lays down, you plug your machine in, bingo, you're treating them. You don't have to set up everything special for your animal. So they can use it as a dog bed even when they're not a dog or a cat area, even though if they're not being treated. So it doesn't. That's one of the versatile aspects of the mat. Okay. Let's see, does it really it really does reprogram. You're talking about the Braintap. Hello, JJ from Texas. Thank you for being with us. Sandy's with us. All positive reactions with the Braintap. It's a neat product, and using it in conjunction with the Wave Oasis, with the vibration and the music and the Braintap and the PEMF, if you want to do it at the same time, is amazing. A lot of people will use the Wave Oasis. They'll do the PEMF, then they'll turn the PEM off, and then they'll get the vibration and the music and put their Braintap on and just kind of go to La La Land and some kind of, I almost call it a dry float. We're working on putting some floating apparatus into our clinic for floating and cryotherapy and all kinds of things that we want to do in conjunction with the athletes, in conjunction with the MagnaWave, as we build out the clinic concept that people may want to adopt and pursue in their localities. But certainly the Wave Oasis provides the vibration and the sound and everything to almost give you the feeling that you're floating. And so that if someone doesn't want to get in a float tank and be wet and they want to achieve something very similar, then the Wave Oasis can be beneficial for that happening, and how it can be used. Let's see. Can you explain the new design of the double hoof mat? It's more solid on top now. Well, it's just the design's there, so some people wanted to be able to treat both feet at the same time. They did not want to have a different elevation. If you put your foot on the hoof pad that we've had for a few years now, and to where they someone may think they're uncomfortable, they're off balance. They're not off balance, but just being uncomfortable. So it just gives you the opportunity to put both feet on the mat. And, if you have a situation of navicular in both feet, or you're just having some inflammation in both feet, or you just want to be relaxing, again, to put both feet on the mat and have the signal coming up through the feet is much like reflexology and can help a lot of things in the body simply by treating from that type of direction and treat the feet in that fashion. Let's see if I may, body mat. Double checking body mat. Which machines is it compatible with plug wise? Well, we have a mat that's suitable for 2 plug machines. We have some mats that is suitable for the single machines, and as well the single plug machines. And so we have that available. Have to look on the website and see where they are, because they're changing things quite often on the website with what's available for various devices that we have. Let's see. Can you explain the design? Oh, I did that. The hoof mat. Have chronic anxiety and get overwhelmed, but want to be off my meds of 20 plus years. So looking for reprogramming for sure. Kim's talking about the Braintap and how to use it when you don't want to be on meds. You want to try to do something that's a little more natural for you other than medication. Would treatment time for hooves be less using the Zoom paddle versus the MagEnergy mat with the mat guard? Well, the paddle certainly is smaller, and it's giving a more intensity, more directed straight from the paddle. You might not need as much treatment time with the paddle that you might provide with the mat, but again, good circulation provided to the area. If you're wanting to get rid of an abscess, then you want to go with something that's going to give you more direct intensity, that's more focused right on the area. So the paddle or the butterfly would be potentially more helpful in those type situations. But to put both feet on the mat and treat and go in that situation, that can still be very effective. I remember when we first brought out the semi, and it was a third of the power of the max machine, and we would treat and sometimes pull an abscess after 1 or 2 treatments or 3 treatments with the max machine. And I thought, well, gee, that's going to take 6 or 7 treatments utilizing the semi, and which was not the case. 3 or 4 treatments with the semi on the same type of thing, because of the circulation, because of the oxygenation, helped in many cases with abscesses and so forth. So certainly the strength in some cases is much better and much quicker than the lower power devices that we have. But when you get right down to it, it's not that different. People, by tendency with the lower power devices, they're not feeling it as much, so they think, let's do it longer, which you can do, and to get the results you're looking for. With the low power devices that only get up to 50 Gauss or so, they'll talk about treating for an hour a day or 2 hours or whatever, or even sleeping on a mat for 8 hours. And because it takes time to build up the result that you're looking for. And so that's certainly the case when you deal with intensities. Higher intensity is really what the higher intensity has done, is it's sped up the recovery time. It's sped up the healing process. It has done all of those things for the body that the low power units are doing, but they're just slower in what they do. So that's the biggest thing that the high intensity devices have brought to the surface. Okay, let's more comments. Let's see. Okay, so they put the information here on the mats with a link, so that's very helpful. What was the redesign of the double hoof mat? Who is the top different now? Becky, I'm not sure. I know they've been dealing with the rubber top and how to pursue that. And again, I've been away from that particular device development and restructuring, but they are working to have the best rubber top and best composite that they can have for durability and still provide the penetration that we're looking for utilizing the PEMF. Let's see. How many Gauss in the Soul machine? The Soul machine is FEI acceptable with certain attachments. The sole machine gets up, I believe, to a depending on the attachment, to 3,000 to 4,000 Gauss if you're using the paddle. When you get down into the large wave wings and the large loop, you can be down in the 1,000 Gauss range for application. Certainly, how you turn the machine up or down will delineate or determine how much Gauss is being delivered, but the paddle delivers the maximum amount of Gauss. There is I believe on the website under research, there is a listing of Gauss delivery based on, I believe, the butterfly at a particular setting, or the highest setting and the lowest setting. Where you adjust the machine in between, if it's 1 through 10 or 1 through 20, it's going to vary depending on the attachment that you're using. Okay, let's see. 3,900, Cameron points out on the sole. There it is. Great. How much Gauss in the sole machine? Cameron just put that up there. Best way to use the LZR with a 70-pound black standard poodle. Well, you want to, in a situation of a poodle, to get good absorption, you want to separate the hair or the cover, the hair or fur, and you want to separate it. And poodles don't shed, so they have hair. I believe that's the case, right? But okay, I get off on that. Trying to figure out which one it is. But at any rate, simply you would want to separate the hair, so you've got some skin that you're placing the LZR on the area that you're wanting to deal with. If it's a shoulder issue, if you want to treat the top of the head for pole issues or whatever, but you would put it on. The treatment times are not different. You might treat, now if you're going through more thickness of fur or hair, you might want to let the heat help you. You're going to get some light penetration. The LZR will penetrate bone. It goes in. Dr. Turchin talks about this, where many different lasers and stuff really don't penetrate the bone. The LZR, based on the amount of wattage and the light, will kind of penetrate into bone. So you can put it on your forehead, and people do this for anxiety. They'll put it on their forehead for 30 seconds, and then they'll put it on their ear for another 30 seconds, and the other ear, not without the hair over it if you have longer hair, but just do the ears and the forehead, and it's very beneficial for anxiety, relaxation, PTSD, whatever it may be, and so that's very effective there. Now, with regard to the poodle, that would be the way to do it. If you're putting it directly on the hair and you can't separate it enough to get to the skin, just leave it on a little longer, or maybe do a treatment for a minute, wait a minute or so, do another treatment. It gets warm, so you don't want to, it's not that you're going to burn, but it could be uncomfortable to the animal if you put it on for 2 minutes, just boom, boom, or 3 minutes, boom, boom, boom. And so just give it a little relaxation, let it do that. That's why when we use it for weight loss or inches, where you move across, if you're doing the midsection, do it a minute, move it across the body in sections of a minute, and then use the MagnaWave, because when it shrinks those fat cells down to like little fat cell raisins, then the MagnaWave helps move that through the lymphatic system and helps with inch reduction and weight reduction at the same time, utilizing the light. So that's how I would approach the animal. Again, you can ask those questions to Teresa and Aaron, because they've talked a lot about that and how they're approaching the LZR with the horses. A lot of our people are doing it. They're not worried about on the horses necessarily separating the hair or the coat, separating the coat so they can get right at the skin. Some areas of the body, certainly the girth area and the inside of the leg, there isn't as much fur or coat, and you can get better to the area directly by placing it right on the area. But that's how I would approach a long-haired dog or a cat with the LZR. Hope that helps. Okay, let's see. Can the MagnaWave pulse penetrate through wood? For instance, if a horse is wearing a therapeutic wooden shoes or rubber-soled boots, yes, it'll go right through that. there is resistance. It's not going to go through as well or get to the area as well as it would if it's just with a metal shoe on and you got more of the hoof exposed. But it will penetrate right through that. The only thing it won't go through is lead, and we've had some issues over the years with discussions with chicken wire because the way the wire is made, it kind of deflects everything. But it will penetrate through a cast. It will penetrate through bandages. If you want to treat someone, it's got a wound and you want to treat straight through the bandages, it'll do that. It'll penetrate right through there. It'll go through a wall. But again, there is resistance, so it's going to kind of slow it down. It's the same thing on a person, on a horse, where we talk about the potential depth of penetration of 16, 18, 20 inches or more. It depends on the moisture content, of the muscle, and what's going on. So there is a resistance. It's just like anything else. If when you use a hose and you're trying to hose off your home and you're trying to clean it off, you have areas that you got to let it persist for a while because it's got a buildup of dirt that's been there, and the hose just isn't cutting it enough, and you don't have a pressure washer to get to it. So you just got to kind of put it in those kind of mindsets as you go through. Wow, we're out of time. This is amazing. I think I got all the questions. I hope I didn't miss any. If I did, I apologize. It gets a little difficult to read through this sometimes because it jumps. Every time somebody makes a comment, I have to go back and figure out where it is. So the folks that are on CastBox, I want to thank you for being with us. Our friends, our practitioners, our people who are watching on Facebook and YouTube, thank you so much for being with us this week. We look forward to being with you again next week. Please wave on to better health and wellness. Have a great week and enjoy the Derby this coming weekend. Thanks for being here. Talk to you later. Bye-bye.